The integrated system of care is that services are aligned across our geographic area and that the appropriate linkages and coordinating mechanisms exist to ensure that the care that individuals receive is seamless. We want to make sure that even if I live in Bright, my level of care is as seamless as the person who lives in London, the person who lives in Exeter, Seaforth, wherever you may be. The key enablers to help us achieve the system are identified in the oval at the top of the surrounding the diagram, and these will be dealt with in a bit later in the presentation. In addition, the two service delivery models are population-based integrated health services and centrally coordinated resource capacity. Looking to these two service delivery approaches, you can see that population-based integrated health services talks to the collective needs of a local population and its health service providers. These are the things we want close to home, whether it's primary care, home and community care, emergency services, mental health and addiction services, complex continuing care, rehabilitation, chronic disease prevention. Those things we want close to where we are. There is also, you can see there's a total health management, there is an individual accountability component. We are all responsible for a certain level of our own care. Whereas the centrally coordinated resource capacity focuses more on the LHIN-wide coordination of medicine, surgical and critical care, to maximize access to the services. These are the key enablers. Multi-level system of navigation. We know that not everybody can enter the system with the same level of ease or knowledge. Some people may be able to maneuver throughout the system on their own or with their family support, where others may need more assistance, facilitation as they go through that. The technology is very important. We all know that, well, Dr. Milne referenced this with his emergency department, that now with the PACS, they are able to access more information and send more information back and forth. Technology has a critical part to play, and we want to keep that moving forward. The people who provide the care within our communities are also essential, and we want to make sure that they are there, and that's a growing concern, to make sure we do have the resources available. And of course, we need a clear implementation plan and an accountability framework to ensure that as we go forward, we are moving in the right direction and making sure it's a system-wide program. These points identify how this is different from today's model. Collaborative partnership across health sectors, equitable distribution of services, seamless referral processes, increased access through multiple entry points, so that it doesn't matter where I enter, I can get the care, or the person has the knowledge to direct me to the care I need. Expansion of provider roles and enhanced capacity of direct service providers on knowledge, understanding of services and individual health needs. Standardized evidence-based approaches to care provision. The patient and the client is a central member of the team. You're empowered to self-manage, and that modifications to existing organizational structure. This is how we're going to get there. We're not going to achieve the change overnight. It's going to happen through 3-year IHSPs, and you can see how they loop over. Certainly our previous IHSP helped us to get to where we are now, and as we move forward, we will ensure that we are aligning future service accountability agreements with the vision, the decision-making and prioritization will be aligned, and that we are incenting health service providers and partners for integration and innovation as able and deemed appropriate. Providers and professionals need to seek opportunities to integrate as they align to the blueprint and IHSP. Transforming governance we're looking to you to do that, you as the board members, to transform the governance and the leadership so that we can facilitate and oversee this change. We need to be looking at success from a system, not just our own organization. And as the Health System Design Steering Committee was working through the process, a quote came from one of them: health service providers and healthcare professionals need to express interest in the success of everyone's organization as well as their own. And that's a key quote. We need to work together. We need to be looking at the big picture and celebrate the successes from a big picture perspective as well as our own successes. It's our own successes that are going to build to that big success, but we want to be aware of the big picture to ensure that we're all aligned and moving in the right direction. This is the Integrated Health Service Plan for 2010 to 2013. You can see the system level goals are identified: healthier Southwest LHIN community, equitable access, quality of care and service, integration of healthcare to delivery, and sustainability of the Southwest local health system. To attain that, we have the Blueprint Integrated Service Delivery approaches. We've talked about the two models, and then we have the strategic plan direction. At the bottom are the key enablers: multi-level system of navigation, information and technology, the importance of the HR, and the implementation and accountability framework that we talked about earlier. Now, planning for implementation. Our engagement with the LHIN steering committees and other groups continues as we develop this framework. These are supported as we continue to roll out the comprehensive communication strategy that is clearly focused on several audiences, including health service providers and the general public. On February the 26th, there is a LHIN-wide webcast which will be held for health service providers, and we certainly are hopeful and encouraging our health service providers to access that. Up-to-date materials are posted on our website, and we encourage all of you to access that so that you are up to date on what is happening, and that information supports communication efforts so that we can ensure everyone who works within our health care in our LHIN is learning about our shared vision of health care within the Southwest. Going beyond April 2010, you can see that we will be establishing service accountability agreements that align. We will initiate expressions of readiness process to support the development of the LHIN investment strategy. LHIN performance measurement status report quarterly on website and distributed widely. And the LHIN website provide oversight and learning system components. So again, please access that information. And I know in our meeting this afternoon, Julie White, our communications person, is presenting information of just how much our website is being accessed, and we certainly are seeing growth in that area. So what is your board's role in Blueprint and IHSP considerations? Well, we are hoping that as your board accesses the information that you will understand how to align your strategic planning with the Blueprint vision and IHSP priorities. We want you to seize the opportunity to work collaboratively with your partners to align your organizational goals and strategies with your partners. And we want you to ask your organization's senior leadership how your organization is working to achieve the Southwest system level goals and to monitor progress. Certainly the Local Health System Integration Act clearly states that it is intended passed to provide for an integrated health system to improve the health of Ontarians through better access to high-quality health services, coordinated health care and local health systems across the province, and effective and efficient management of the health system at the local level by local health integration networks.